A new study has shown that younger patients are demanding antibiotics against the advice from their family doctors. It also found that around 12% of oral antibiotics were prescribed without any diagnosis of infection. Doctors say such misuse could lead to antibiotic resistance, meaning stronger doses for the same or even less of an effect could be needed in the future.
Waiting in line at the clinic could worsen anyone's mood, especially when they're sick. For some, the desire for a quick recovery from a bout of illness could lead them to seek out powerful drugs like antibiotics. But over-reliance and misuse of such drugs could have serious consequences.
In the event of a patient, if they actually have a bacteria that actually develop resistance to the antibiotic itself, means that even if they take the antibiotics itself, it will not be effective in treating the infection. Which means that if they have fever, cough, and flu itself, the symptoms will continue to go on despite taking the antibiotics.
Family doctors from the National University Polyclinics have completed Singapore's first primary care study. It involved over 3 million outpatient consultations at 7 polyclinics from 2018 to 2021. Doctors discovered that younger patients between 21 and 44 years old have a poor knowledge of antibiotic use. They say this has led some patients requesting for the medication, even when their condition might not warrant it. And it's a situation echoed by other general practitioners.
We have patients that are pushy, requesting for antibiotics, pressurizing us for antibiotics. They just need a quick fix, but that's really the wrong management. At times they are impatient because they have to get their child well as they have to go back to work.
Misusing antibiotics could also have a wider implication.
Inappropriate use of antibiotic actually cause more antibiotic resistance in the community. The community, we have to use stronger and stronger options. By the time the patient ends up in hospital, even the second line, third line antibiotics may not work.
As Singapore moves towards a national preventive health plan, the role of primary care physicians will be more important. Apart from educating patients, GPs also need to dispense medication appropriately.
We definitely need to educate my physicians to, prescribe accordingly, to the diagnosis, and try to make the diagnosis as to why you're giving antibiotics. So each antibiotic prescription must have a certain indication, and this must be attuned to antibiotic guidelines that has been present.
The National University Polyclinic says it will be creating its own guidelines on the proper prescription of antibiotics.